cord occurs due to the bullet injuries, which causes dislocation of spinal cord, or accidents which cause dislocation of spinal cord or occlusion of the blood vessels. The complete transaction causes immediate loss of sensation and voluntary movement below the level of lesion. Even though the higher centers remain unaffected, the spinal centers below the level of injury lose their function. The effect occurs in three stages, that is, stage of spinal shock, the second stage of reflex activity, and the third stage of reflex failure. In stage of spinal shock, it is the first stage of shock and effects that occurs immediately after the injury. It is also called the stage of lacerity. The patient feels as if he is cut into two portions. Various signs and symptoms that develop during this stage are: there will be paralysis of the limbs. Depending on the level of lesion, the paralysis of the limb can be of the following types, that is hemiplegia, that is paralysis of one half of the body; quadriplegia, that is paralysis of all the four limbs; and paraplegia, that is paralysis of both the lower limbs. There will be flaccid paralysis. Because of the transaction, the isolated segments of the spinal cord have lost their power of mediating reflex functions. Therefore, the muscles are completely paralyzed. So, there will be flaccid paralysis. There will be loss of reflexes. All the spinal reflexes are markedly decreased or lost because of the injury to anterior and posterior nerve roots. There will be loss of sensation. All the sensation below the transaction is lost because of injury due to the posterior nerve roots and sensory neurons in the posterior gray horn. Then it affects various visceral organs where urinary bladder and rectum become paralyzed, the extrusor muscle become atonic, there will be retention of urine and constipation, the penis is flaccid and erection is not possible. There will be venous return get affected very much. Venous return is very much decreased. Venous return depends on the muscle tone during resting condition. During activity, it depends on the contraction of the skeletal muscle, which is called as muscle pump. But in complete transaction of the spinal cord, muscle tone is lost and flaccid paralysis occurs, leading to decreased venous return. In addition, the limbs are immobile and smooth muscles of the blood vessels lose tone. So blood accumulates in the lower limb, becomes cold and blue. That is, it becomes cyanotic and due to accumulation of the blood in the lower limb. The effect on the blood pressure. The effect on the blood pressure depends on the level of injury. Lesion anywhere below L2 segment, the blood pressure is not affected much because of the sympathetic vasoconstrictor fibers leave the spinal cord between T1 and L2 segments. Lesion or above T1 segment, all the sympathetic vasoconstrictor fibers leaving the spinal cord from T1 and L2 segments are transected. So that is completely cut off from the higher medullary cardiovascular center regulating blood pressure. So BP fall occurs drastically. The mean arterial blood pressure falls below 40 mm of Hg. Skin becomes dry and scaly and bed sores may develop, and no sweating in the region affected by vasomotor paralysis. Severity of the complete transaction depends upon the level of lesion. The complete transaction at the cervical region can be very fatal because the diaphragm and other respiratory muscles are cut off from respiratory centers. This leads to paralysis of these muscles, leading to sudden arrest of breathing. In humans, stage of spinal shock usually lasts for of at least 2 weeks. There is a functional depression of the nervous system, and this phenomenon is called as diastasis. Then the stage of reflex activity. This stage is also called as stage of recovery. After 3 weeks of period, depending on the depending largely upon the general health of the patient, the reflex activity begins to return to isolated segments of the spinal cord. First, the functional activities return that are of smooth muscle, Urinary bladder becomes automatic. Similarly, reflex defecation also occurs. The next sympathetic tone of blood vessels is regained as a result of which blood pressure is restored to normal at rest, but precise feedback regulation is absent and wide fluctuation in the blood pressure are common. Then the skin, which has become dry and scaly, now shows sweating again and it becomes more healthy. Then bed sores heal up rapidly, and because of accompanying return of reflex activity of the skeletal muscle, circulation through the limb is greatly improved and they become warm and good color. Third one is muscle tone. The tone in the skeletal muscles returns slowly after 2 to 3 weeks. The tone of the flexor muscles return first, so that now even though the both flexors and extensors are hypotonic, the flexors are less hypotonic than the extensors. The limb in this condition adapt to a position of slight flexion and paralysis. Therefore, it is called as paraplegia in flexion. Then reflex activity. Reflex activity begins to return after a few weeks of return of muscle tone. Flexor reflexes appear first. In the first reflex which usually appears is the Babinski's reflex. That is Babinski signs positive. Mass reflex can be elicited in some cases by scratching the skin over the lower limb or the anterior abdominal wall. This reaction constitutes spasm in the flexor muscles of both the lower limbs, evacuation of urinary bladder, and profuse sweating. Tendon jerks begin to appear. Initially, the knee jerk returns, then the ankle jerk. The mass reflex can be utilized to provide paraplegic patients a degree of bladder and bowel control. Patients can be trained to initiate urination and defecation by intentionally producing mass reflex with help of stroke or a pinch on their thighs. Then the stage of failure or reflex activity. Stage of failure of reflex activity. As the stage of reflex activity continues, a time comes when a reflex activities of stage 2 fails because of the degeneration of the neural tissue of the spinal cord below the lesion and intercurrent infections. Once again, there develops hypotonicity of muscles, mass reflex disappears, bed sores appears, and again patient dies. Though the reflex movements return, the muscles below the level of injury have less power and less resistance. Usually the general condition of the patient starts deteriorating, and in general malnutrition, infection, or toxemia causes failure of reflex function. The reflexes become more difficult to elicit. The threshold for stimulus increases, mass reflex is abolished, and muscles become extremely flaccid and undergo